This is Amina's and Darlene's presentation over bulimia. Bulimia is an eating disorder that involves an individual to overeat, and it can be hereditary. Some of the behaviors include self-induced vomiting, exercising all the time to prevent weight gain, binging, fasting, and eating laxatives. An individual may consume 3,000 to 5,000 calories in 1 hour just from binging. After a binge cycle, an individual will begin to panic and go into extreme measures to get rid of the food that they have just ingested. Associated mental and medical risk factors with bulimia are poor body image, depression, damage to a person's throat and esophagus, and low self-esteem, and high risk of suicide. Individual's body image is a key feature and a symptom of many eating disorders, also known as body dysmorphic disorder. Individuals with bulimia often tear and rupture their throat and esophagus. Individuals with eating disorders often exhibit traits associated with low self-esteem, such as problems with their overall self-image, concern over their weight and shape, and negative attitudes about who they are as a person. So next we will review our video that we found that explains bulimia.
Extreme weight loss and physiological damage. Another common eating disorder is bulimia nervosa. While anorexia is characterized primarily by the refusal to maintain a minimal body weight, bulimia is not. People with bulimia tend to maintain an apparently normal or at least minimally healthy body weight, but alternate between binge eating followed by fasting or purging, often by vomiting or using laxatives. A bulimic body may not be as obviously underweight as an anorexic one, but that addictive cycle of binging and purging can seriously damage the whole digestive system, leading to irregular heartbeat, inflammation of the esophagus and mouth, tooth decay and staining, irregular bowel movements, peptic ulcers, pancreatitis, and other organ damage. Sometimes the two diagnoses can be difficult to discern, especially because someone may shift back and forth between anorexic diagnostic features and bulimic diagnostic features. The DSM-5 recently added a third category called binge eating disorder, which is marked by significant binge eating followed by emotional distress, feelings of lack of control, disgust, or guilt, but without purging or fasting. Although sometimes triggered by stress or a need for or lack of control, the presence of an eating disorder is not a telltale sign of childhood sexual abuse, as was once commonly thought. Instead, these disorders are often predictive indicators of a person's feelings of low self-worth, need to be perfect, falling short of expectations, and concern with others' perceptions. Although the prevalence of bulimia and binge eating is similar among ethnic groups in the United States, anorexia is much more common among white women, often of higher socioeconomic status. But the prevalence of these disorders is rising in males too. Today, between 10 and 20% of people diagnosed with eating disorders are men who feel the same pressure to attain what they imagine is physical perfection. And that's worth noting. These disorders have strong cultural and gender components. The so-called ideal standard of beauty varies wildly across cultures and time, and thinness is far from a universal desire, especially in countries where malnutrition and starvation are problems. But in the Western world, and increasingly in other countries, thinness is a common pursuit, and being bombarded with images of unrealistically slender models and jacked celebrities has increased many people's dissatisfaction or even shame and disgust with their own bodies. These are all attitudes that can contribute to eating disorders. Some people have even had plastic surgery to look more like Beyonce or J-Lo or Barbie. When taken to extremes, this kind of behavior starts inching into the realm of body dysmorphic disorder. Body dysmorphic disorder is another psychological illness, one that centers on a person's obsession with physical flaws, either minor or just imagined. Those suffering from this
We viewed the article. It's called Increased Morality in Bulimia Nervosa and Other Eating Disorders. Okay, this article suggests that there is evidence that suicide morality may be higher in eating disorders than any other psychiatric illness. This article also examined if anorexia had a higher risk of suicide than bulimia. The patients in this particular study took place in an outpatient eating disorder clinic at the University of Minnesota between 1979 and 1997. There are 1,885 patients who completed eating disorder questionnaire. This questionnaire assessed demographic variables, eating disorder behaviors, and cognitions, other psychopathology, current, prior, treatment experiences, and medical history. Diagnoses were created based on the data from the eating disorder questionnaire. For anorexia nervosa, individual BMI at the time of the assessment greater than 17.5 and fear of weight gain as very much and extremely. For bulimia nervosa, BMI less than 17.5 had a large binge eating episode and had binge eating at least twice a week for the last past month, plus vomiting, using diuretics, laxatives, Aminas, fasting, and exercising to make up for their eating habits at that time. All other patients were considered to be having an eating disorder not otherwise specified. The results were that the majority, 95.1% of the sample, was females. The most common diagnosis was bulimia nervosa, 48.1%, followed by the eating disorders not otherwise specified, 42.5%, and anorexia nervosa, 9.4%. Suicide mortality ratio of anorexia nervosa was elevated. It was not significant, but the elevated risk for suicide examined in the shown in bulimia nervosa and eating disorders not unspecified were significantly higher. These are our references that we use for our presentation, and these are the national web resources that we use as well. If you have any questions, feel free to ask. Thank you.